Hi friends, today we are at Rajahmundry, one of the most beautiful places in Andhra Pradesh. It's an excellent city with amazing views of the Godavari river as you see behind. What an amazing view, morning sunrise, beautiful coconut trees. So I'm here for the APDF 32nd annual conference. For the first, it was started in 1988, and since then, every year they had been conducting this wonderful knowledge sharing platform. So I just thought of sharing some views about what is going to happen. The diabetes, the lifestyle diseases are increasing very rapidly globally, also in India, especially in Andhra Pradesh, Telangana, and South Indian states also. Obesity is increasing, obesity among children, obesity among women, and of course in men as well. So the food habits are playing a vital, important role in this obesity transformation. So especially after COVID, the consumption of calories has gone up very much. The sedentary lifestyle, exposure to the phone, exposure to the internet, watching of the YouTube videos. So once we open the YouTube video, without our knowledge, we would be spending more time than what we actually thought of. So all these aspects are pushing the people into obesity. Once the body weight increases beyond normal, there is definitely need for more insulin. So then this hyperinsulinemia happens, and then the weight gain may be even more at this particular point, further developing to diabetes, dyslipidemia, increased cholesterol, especially the triglycerides, and increase in the blood pressure. So all these aspects further leading to other micro and macrovascular complications. So it's the best to avoid all such diseases, prevent such diseases, and lead a very healthy, happy life. When it comes to food, it is very important to choose the food very wisely. What is the one which you actually need, and what are the ones which you shouldn't be eating at all. So good food habits are the secret of good health. And exercise is equally very important to control diabetes or to prevent diabetes or for any aspect. Exercise can be done, and it should be done by anyone of any age. So saying everybody should be doing some amount of exercise every day. Many of us do walking, 30 minutes to 1 hour of walking. Many people do walking, which is very good. But resistive exercises are also very important to keep up the muscle strength. If you want the muscle strength to be good, resistance exercises are very, very important. And especially when someone is having diabetes and they are taking medicines to control diabetes, or without medicines, whether they are able to control diabetes with only lifestyle modification with appropriate diet aspects, still resistive exercises are very important. I have patients at the age of 75, 80 years also hitting the gym and doing very good. Many people may complain about having knee pains for doing exercises, but if you are having knee pains, also some exercises can be done. Take the advice of an expert, maybe a physiotherapy doctor or your gym coach. They will be able to explain you how best you can do the exercises. When you are in gym, avoid doing individually, independently in the beginning. Take the help of the personal trainer who can actually guide you through the process and help you to not only use the gym in a proper way, but also sustain. We always need to keep in view of the long term benefits. We are not doing it for today or tomorrow, right? It's for the long term benefits, long term goals we need to have. So definitely coaches will be able to help you to focus on exactly what is very essential for you. And timings, many people would be wondering which time the exercise should be done. See, ideally morning is the best time, everyone knows about it, but there are people who can't be able to do in the morning because of their work culture or work nature or different timing aspects. So in such condition, any time of the day is good for you. So never skip the exercise because you couldn't do it in the morning. Do it in the evening. If you're not able to do it in the evening, then find the best time for you, which is, equally right to do. But optimally, morning is a perfect time to do the exercises and gym. Mentioning about exercises, we are not ignoring the yoga. Yoga is the best for stretching, relaxation, the mind relaxation, especially when you are able to do with the help of a yoga guru who can actually guide you through, all various aspects of yoga and, motivate you to keep regularly following the yoga practice is very important. Surya Namaskaras are very important. So, as many yoga gurus say, if you are not able to do every yoga asana in a detailed manner, but at least do the Surya Namaskaras they mentioned, because the Surya Namaskaras contain at least 11 postures of complete body stretching exercises which help from head to toe to relax and also to strengthen. So, never ignore the values and importance of yoga as well. And breathing techniques are also very important, because nowadays, because of our sedentary lifestyle, it seems that we are breathing very superficially. It is very important to take deep breaths. So deep breathing exercises are very important, typically to allow the lungs to expand fully and inhale maximum air possible, to keep the lungs in full functionality. Breathing exercises are very important. And apart from that, Kapalbhati and other breathing techniques, pranayam are also important. Never ignore the vital aspects and the basic essence of why we practice a certain ritual. And feasting, parties have become too much. Repeated parties are many, so kindly be aware and cautious about what you are eating and how much you are eating and what kind of food you are eating. Essentially, this will define your health in the future. So be cautious, and as they say, drink responsibly. Now, eating responsibly is also very important. Eating responsibly is also equally important to maintain good health. And never be, never hesitate to discuss if you have any questions with your doctor. Maybe I always mention, in the first visit it may be very sometimes crucial to discuss everything with your doctor in the first consultation, but keep certain things reserved for the second consultation, third consultation, and so on. Maybe in the first consultation, let your doctor do what is the best for you. In the second consultation, you can discuss certain other aspects, and then in the third consultation, you can explore more options and discuss in depth with your doctor. So, wanting to know everything in the first consultation may not be practically possible. Definitely, your doctor wants to tell you more about your diabetes or hypertension or dyslipidemia management, but allow some time. So, in the first consultation, it would be challenging for the doctor to choose what is the right medications for you, or whether he should choose no medicine but to allow you to follow the good lifestyle modification with good diet and good exercises to stabilize your blood glucose levels to stabilize the blood pressure levels and also to correct the cholesterol levels. And many of the times nowadays people are also having vitamin D deficiency. So vitamin D deficiency corrections are also vital. So in this manner, uh, the patient can get the best help from their doctor, but don't rush the doctor, or don't force the doctor to answer many questions on the first consultation. It is also important to see that your doctor is comfortable with you as well. I completely agree that a patient should feel comfortable with the doctor, but it is also important that the doctor also should feel comfortable with his or her patient. So cooperate with your doctor. And dietitian, if you have a dietitian or a nutritionist with your doctor, never ignore whatever they say. Most of the points maybe nowadays you might be knowing because you come across in YouTube or any Google sites, but listen to whatever your doctor is advising you and the nutrition is trying to advise you, and take those points very wisely and implement them in a smart manner. Don't rush through implementing everything in a single day, bring down the glucose levels. But many of the times in such rushing conditions, after a while, blood sugars tend to shoot up. So it is also important not only bringing down the glucose levels to normal, but also to take care that they don't rise back. So with this I will end this video and hope to see you soon in the next video with more aspects. Thanks for joining. All the best. Have a good day.